So let's discuss some of the important midfoot ligaments. So I'm showing those in blue, and just to orient you again, we have the fibula, the tibia, which articulate with the talus. This is the calcaneus, the cuboid bone, we have our cuneiforms, metatarsal shafts, and over here is the navicular. So I'll start with the largest ligament, and that spans from the talus to the navicular, and it helps to strengthen that medial arch of the foot. So the name is quite simple. It goes from the talus to the navicular, so it's called the talonavicular ligament. Okay, then you can see between the calcaneus and the cuboid, we have a ligament that is called the calcaneocuboid ligament. So this is one that can be injured with midfoot ligaments. So midfoot sprains, So the midfoot sprains can commonly occur with the same mechanism for our inversion injuries that injure the ATFL ligament, which remember is the one that goes from the talar neck to the fibula. So it's very common to cause movement between these joints and then cause sprains to these ligaments. So I'll talk you through the rest of these ligaments that are shown here. We'll just take the ATFL off. So above the calcaneocuboid ligament, we have a little ligament that's called the bifurcate ligament. So because there's two portions to it, bifurcating, we call it the bifurcate ligament. So there's a calcaneocuboid component, so that's this bit, so from the anterior process of the calcaneus to the cuboid, and then there's a calcaneonavicular component to it. And this ligament underlies a little muscle called the extensor digitorum brevis, and it extends these toes, it assists the extensor digitorum longus, and because that extensor digitorum brevis has its origin on top of that bifurcate ligament at the calcaneocuboid intersection, then a sprain or a hyperextension injury or an inversion injury can actually cause a small avulsion of that muscle and with it injure the bifurcate ligament. And because the bifurcate ligament attaches to this anterior process, sometimes a portion of the calcaneus is fractured off. So the anterior process can appear fragmented and avulsed. The other ligament that I'm showing here is the dorsal, because we're on the dorsum, cubonavicular ligament. And that's all I wanted to discuss in terms of the midfoot ligaments. So then imagine between each of our metatarsals, there's a ligament called the intermetatarsal ligaments. And then between all of our tarsal bones and the metatarsals, we have tarsometatarsal ligaments, like this one and this one. And then between the cuneiforms, you have ligaments called the intercuneiform ligaments. So there's lots and lots of ligaments. Distally between our MTP joints, we have a ligament spanning across the arch of the foot. So if I was to place this ligament underneath, we've just had a fracture. So imagine that ligament running beneath all of those joints, and that's called your deep transverse metatarsal ligament. So it's a good landmark for when we start looking at our nerves running through the web spaces. And that's a wrap for the dorsal foot ligaments, so the midfoot ligaments, so the talonavicular ligament being an important medial stabilizer, the calcaneocuboid ligament, and then we talked about our little bifurcate ligament that sits in here, spanning from calcaneo to cuboid and calcaneo to navicular, but we simply call it the bifurcate ligament.